So can you give our audience and our viewers some insight into Sabra Healthcare, what you focus on, what you do, your tenure with the company?
Certainly. So Sabra Healthcare REIT is a healthcare-focused real estate investment trust. We invest primarily in senior housing, skilled nursing, some hospital segments, but the first two categories are our primary investment categories. I'm the company's chief investment officer, and I've been there since the company was started. We were formed through what we call a PropCo-OpCo split. So Sun Healthcare Group was a publicly traded skilled nursing company, and it was run by Rick Matros. And he decided to undertake essentially a value engineering maneuver where it split the real estate from the operations and had two publicly traded companies from one. And actually Rick decided that he really liked the idea of going to a company that only had 6 employees, which was the REIT, as opposed to 30,000, which was the operating company. And so he remains our CEO to this day. But that's how we started. We started in 2010 with one tenant and a well below investment grade credit. And today we have about, and we were something like $700 million in value, total asset value. And today we're $7 billion and about 700 assets, 70 tenants. And we have more than six employees. We're actually up to about 30, 32. I now lose track. How's that? That actually probably answers the question. I have to count like the phone directory to see how many people we employ. So it's been a heck of a ride over the last 8 years. And part of that ride included merging with another publicly traded healthcare REIT called Care Capital, which we did about 15 months ago, and that doubled our size.
So I have a fact here, and we built it into the question. So by 2029, more than 20% of the U.S. population will be over the age of 65. So how has this affected demand and changed the way you position your portfolio? We talk about senior housing.
It's a great setup for me, so thank you.
Okay.
So what people forget, and I always laugh about how when private equity is sort of flocking to the senior housing space in the last couple of years, and they've done this before and bailed, but history repeats itself. They forget to look at the x-axis, okay? X-axis being time or age. Because the people who move into senior housing are the same age as the people who go to skilled nursing facilities. They're on average about 85 years old, not 65 years old. So the 65-year-olds, the 60-year-olds are the ones who are placing their parents in these communities. So that big wave is 20 years past.
Sure.
What you just described. There is an increase in the population. It happens ratably. It happens exactly 1 year at a time. Nothing accelerates the path of aging, which is the other thing. There's no compression. There is an increase right now, and people are looking at a fundamental increase in the cohort of people aged 85 plus. That is driven primarily because there was a dip in the birth rate during the Great Depression in the 30s. So as you start to emerge from that, call it 1934, 1935, you start to see a pickup in birth rate. Well, that translates to 85-year-olds just around now, sort of 2019. So there is an expectation that the trough, we're emerging from a trough in terms of the core population that moves into senior housing, goes into skilled nursing for treatment, but it's not. It's not this incredible volume, and it will increase over time because there's no question that the United States population, as well as several other countries around the world, are experiencing a deviation from the traditional pyramid of age cohorts, and there's the baby boomers are slowly but surely going to make their way through and be there to demand a lot of services in the senior housing space, whether it's healthcare, whether it's senior housing, whether it's skilled nursing, whether it's transitional care, et cetera. There are going to be large demands there.
Okay, thank you. So what effect, if any, has the attempted repeal of the Affordable Care Act had on SBRA and the rest of the industry?
The Affordable Care Act hasn't actually impacted the seniors. It's probably had an impact on, it's had an impact on hospitals, it's had an impact potentially on medical office to some extent, but it really hasn't affected the cohort that we focus on because those people are receiving health care because they need it and it's being paid for by government reimbursement through Medicare or potentially Medicaid on the one hand, or in senior housing, it's discretionary income, available income to those seniors. And typically, again, it's a need-based service. So adult child comes home from vacation and realizes that grandma or mom isn't really handling the house like they used to, or they've fallen. There's oftentimes it's event-driven, and they start to look for a situation for usually grandma or mom, where they're safe and they have some supervision, some oversight, because ultimately safety becomes probably the single biggest issue. Unlike in campus housing, most seniors do not want to move to a senior community. So it really becomes a factor of concern and fear. Sure. And their actual safety that drives that decision.
Okay.
I think the message is that the business Sabra is in is actually quite simple. The business our tenants are in is very complicated and highly regulated. And the challenge that every healthcare REIT faces is marrying those two and explaining it to investors. And probably our team is uniquely positioned because everybody but me came from an operating background. And the insights that carries are enormous, and it's a distinction.
All right, thank you.